Now, you might find you can sort of cup that area and give it a bit of a stronger stretch there. But once again, it might depend on the severity. They might just have to put a mild stretch on it. And this is something, you know, often I'll say, give it a stretch first thing in the morning before you step up out of bed, just to give that initial sort of tensile stretch through it. But they can be doing this throughout the day as they feel comfortable. Probably around a sort of 20 to 30 second hold. Like, there's no exact amount, but just whatever they're sort of feeling comfortable with. To increase the stretch a little bit, they can add a bit of ankle dorsiflexion. So if you sort of really just cup your foot a bit more here and extend that while you dorsiflex your ankle. Does that feel a little bit stronger?
Yeah. I have to use 2 hands.
All right, great. And then, yeah, she'd come off it and then reapply, and she might repeat that 3 to 5 times, or like I said before, whatever she has time with. The important thing when we're treating plantar heel pain is we need to take into consideration, you know, how much time does the patient have to do these exercises? Do they want to do them? So we've got to really work with them and find ways that they're happy to incorporate into their day-to-day routine. What we might do now is we'll do a calf stretch. So I'll get Kendall to stand up. Now, we generally use a wall, but we want to stretch both the gastroc and the soleus. So we're going to do a straight knee calf stretch and a bent knee calf stretch. So I'll get Kendall to try both of those. Just making sure that keeping the heel down, knee straight. Should be getting a stretch up through your upper gastroc. Okay, and then, yeah, applying a bent knee stretch as well. And once again, we'll discuss how they're feeling with this stretch. Are there any symptoms? Is it aggravating it, or it feels tolerable? We want to we haven't, during the education phase, we would have discussed a sort of tolerable discomfort. So with these patients, we like to let them know it's safe to do these exercises. It's safe to feel a little bit of discomfort. I generally tell people to stay in a sort of 0 to 4 out of 10 pain range, but it's a very individual thing. Obviously, we don't want to be pushing into really high pain levels, but a bit of mild discomfort is okay. So it's sort of that pain doesn't equal damage. Education is a pretty important part of this. All right. Now, another way we can slightly wind up that stretch is we can use a towel, or I've got the fasciitis fighter here. It's just more of a simple tool, but either or is going to work. So if we have a rolled up towel or a tool to extend the toe, so I'm going to get Kendall to place her foot on either the towel or the fasciitis fighter is going to extend the toe, and now she's going to once again go into a stretch position. Now we know that's just going to put a slightly stronger stretch through the plantar fascia. Are you feeling that a bit more, Kendall? And we could even regress this. So once, like back in the seated position, if they're really sensitive, we could go back to doing it in a seated position as well. But Kendall's tolerating the standing stretch well today. And once again, it could be a straight knee and a bent knee. In this position as well, we could look at sort of like more of a mobility. So she'd sort of go through and back. Yeah, and even the same again, but lifting the heel up. So coming through a bit of a up. So it's more of a big toe / stretch mobilizing drill. All right. Now I'll get Kendall to come back to a seated position. Now, one thing I like to do is a bit of toe yoga. So it's sort of like a good way to try and get that neuromuscular sort of control and wake up the muscles in the feet a bit. We know with these patients, if they've had sore feet for a long time, sometimes they get a bit sort of, those muscles aren't as awake as such. So what I would, and this can be quite difficult for them. So we'll see how Kendall goes. But initially, Kendall, can you raise that big toe without raising those 4 other toes? There we go. All right. And then bring it down. Okay, and then up again. So this takes a bit of concentration and thought. Okay. And then can you keep the big one down and lift the 4 others? There we go. And this is something they can do when they're sitting on the couch or reading a book. It's a low load activity, but can you feel this muscle under your arch working when you do that, Kendall? Yeah. So if they're keeping that big toe down, the flexor hallucis longus should be working pretty well. Great. That's it. So we can play with different options. You can alternate the big toe to the 4.
Now we're getting tricky.
That's it, Kendall. And we can also try and bring this big toe away. So we're engaging the abductor hallucis, which is a muscle which sits in the arch of your foot there.
Oh, I can do that. It's gone the wrong way.
So sometimes with a bit of feedback, you can push against, that's it, push against my. Try, yeah, that's it, yeah. That's it. And also, can you do like a bit of a toe splay? So we often, that's it. So trying to splay those toes. And we're sort of getting all these intrinsic little, so our foot has a lot of small muscles in it, and we're just sort of getting these all working with these different variations. That's it. Well done. And that's quite tiring for you, Kendall? Yeah. Some patients might complain of a bit of cramp doing this. They're really sort of, trying hard. But with practice, we get better at it, and you're finding over the weeks they get quite sort of good at moving those toes around.